Bismillah ar-Rahman ar-Rahim. Our lecture today, the stages and physiology of normal labor. The objective of this lecture: 1. To identify the definition of the labor. 2. To assess the stages of the labor. Labor is defined as the onset of painful regular contraction, more than one every 10 minutes, with progressive cervical effacement and dilatation, accompanied by the descent of the presenting part, leading to expulsion of the fetus and placenta from the uterus. The true labor is begun with a regular shortening intervals between the contraction, one every 10 minutes, with progressive cervical effacement. Effacement is shortening and thinning of the cervix, and the dilatation of the cervix combined with the proper presenting part of the fetus. This leads to expulsion of the fetus and placenta from the uterus. The stages of labor. The labor is divided into 4 stages. The first stage we can call stage of dilatation, extending from the onset of the true labor until the cervix is fully dilated. It is divided into 2 phases. The first phase we can call latent phase, starts from the onset of true labor until the cervix reaches 3 cm in dilatation and lasts between 3 to 8 hours, shorter in multiparous women المرأة المتعددة الولادات. The contraction of these phases occur at least twice every 10 minutes, with each lasting greater than 20 seconds, and its intensity is moderate, and the woman can tolerate with the contraction without analgesia. The second phase is an active phase. It starts from 3 cm to full cervical dilatation, which is 10 cm. The contraction becomes more frequent and stronger. The contraction occurs 3 times every 10 minutes, with each lasting greater than 40 seconds. The cervix should dilate at a rate of 1 cm per hour or faster. This phase lasts between 2 to 6 hours. The duration of the first stage of labor in primipara بالمرأة البكرية range from 6 to 18 hours, the average 12 hours. In multiparous women بالمرأة المتعددة الولادات about 2 to 10 hours, average 5 hours. The second stage of labor is started from full dilatation of the cervix until the fetus is born, and it's also divided into 2 phases. The first phase is passive phase, the time between full dilatation and onset of involuntary expulsive contraction. There is no maternal urge to push, and the fetal head is still relatively high in the pelvis. In the second phase, we can call the active phase, there is a maternal urge to push because the fetal head is low, causing a reflex need to bear down. Duration should last no longer than 2 hours in primiparous and 1 hour in multiparous. The third stage of labor starts from the birth of the fetus until the placenta and membranes are delivered. The placenta usually delivered within few minutes of the birth of the baby. We can notice the signs of placenta separation by sudden gush of blood and leaving the visible portion of the umbilicus cord, with the uterus become round and firm. A third stage lasting more than 30 minutes considered abnormal. The last stage of labor is the fourth stage, is the period beginning immediately after the birth of the child and extending from about 6 weeks. And immediately we can focusing in 2 things: the family attachment and the signs of immediate postpartum hemorrhage. The terms postpartum and postnatal are often used to describe this period. The woman's body, including hormones levels and uterus size, return to a non-pregnant state, and the newborn adjusts to life outside the mother's body. Quiz number 1, define the labor. Quiz number 2, pregnant woman admitted to the hospital with cervical dilatation 3 cm. Contraction occur twice every 10 minutes, with each lasting greater than 20 seconds, not more than moderately in intensity. At which stage of labor the pregnant woman was?